Hello, my name is Mackenzie Brixey, and I will be addressing the impacts of childhood obesity on disease risk in adulthood. Key terms and definitions I will be discussing in this presentation include childhood obesity, which is when a BMI is at or above the 95th percentile for a child's age and sex. Obesity, which can be defined as chronic disease that is characterized by excess body fat that presents a risk to health with a BMI greater than or equal to 30, and overweight, which is also a health condition but with a BMI of 25 to 29.99. Other terms I will discuss and henceforth refer to as their acronyms include cardiovascular disease, systolic blood pressure, diastolic blood pressure, high-density lipoprotein cholesterol, low-density lipoprotein cholesterol, non-high-density lipoprotein, and triglycerides. Childhood obesity is a deadly disorder, and more than 1 in 10 children will be considered obese before they begin kindergarten. 17% of children and adolescents are considered obese, and 32% are considered overweight. The etiology of these conditions are believed to be genetic as well as behavioral. Health risks that childhood obesity are linked to include the development of type 2 diabetes, cardiovascular disease, sleep apnea, hepatic steatosis, which is also known as fatty liver, along with others. Childhood obesity is also linked to social risk factors and problems including, but not limited to, being bullied, which leads to poor mental health, decreased productivity, and premature death in adulthood. Studies have been conducted, and many conclude that more research is needed. However, some disease risks associated with childhood obesity in adulthood include cardiovascular disease, which includes coronary heart disease, strokes, and hypertension, as well as increased SBP, decreased DBP, and increased non-HDL. I will discuss 2 relevant studies, which include the Bogalusa Heart Study as well as the BMC Public Health Study. The Bogalusa Heart Study assessed the longitudinal relationship between childhood BMI and levels of lipids, insulin, and blood pressure in adulthood. Patients were initially examined ages 2 to 17 and re-examined at ages 17 to 32. Of the overweight children, 77% remained obese as adults and concluded that additional studies are needed. They also noted a weak association between being overweight in childhood and adverse risk factors among levels of adults. The BMC Public Health Study focused on addressing the gap between conflicting results with studies conducted between childhood obesity and adult cardiovascular disease. The study uses an aggregate data meta-analytic approach and focused on 23 studies. Studies were chosen based on multiple factors, a few including childhood exposure and adult outcomes collected on the same individuals over time, as well as having 1 or more risk factors including SBP, DBP, HDL, and others. The study concluded that childhood obesity may be a risk factor for selected adult cardiovascular diseases risk factors and found significant and positive association with adults' SBP levels and significant and negative association with adults' HDL levels, and the studies that adjusted the BMI may be a potential mediator with this information. Childhood obesity prevention begins at home, and families should focus on lifestyle changes, which can include making healthy snacks and minimizing processed food intake. Families should also encourage and model healthy eating habits and encourage activity. I have added my sources. Thank you for listening to my presentation.